Good afternoon, ladies and gentlemen. It is my great pleasure to welcome back Professor Michael Frass, Professor Emeritus of Medicine at the Medical University of Vienna, renowned for his leadership in clinical oncology and integrative cancer care, Chair of WHC and President of the Austrian Umbrella Association for Medical Holistic Medicine. Please welcome.
So, good afternoon. I hope you enjoyed lunch as I did. And we will talk now about a study which, or some studies I've published about homeopathy and cancer. In all these studies, homeopathy was used in addition to conventional medicine, was not instead of. The first study is a retrospective one, which focuses on the survival time in tumor patients. The second one is a pragmatic study investigating the influence of additive homeopathy on quality of life. And the third one is a double-blind study comparing or investigating not only quality of life, but also survival. The first one is a reanalysis of survival data of cancer patients, patients who are utilizing homeopathic medicines. And the nice result is if you use a special method, which is called landmarks, then if a patient starts either 6 or 12 months after diagnosis, there's still a positive, significant effect of homeopathy in those patients. And the second one is a study on the influence of homeopathic medicine on global health status and subjective well-being. It's a pragmatic, randomized, open, controlled study. So it's a real-world study, what's happening in the real world. And this was done at the outpatient unit at the Medical University of Vienna. I was serving there for 15 years, from 2004 to 2019. My boss was at this time the top oncologist of Vienna, Professor Zielinski. And all those patients were treated conventionally by help of chemotherapy, radiation, and/or surgery. And patients could ask for additive homeopathy, and there were about 600 patients contacts per year. This was a prospective controlled study. It was randomized. About 200 patients, not only about, but 200 patients received conventional treatment, while 200 patients were additively treated by individualized homeopathy, which means it takes about 1 hour to take the history, and no placebo was used in the control group, so it was a real-world study. If you look to the patient's characteristics, the baseline characteristics were comparable. Also, the different types of cancer were comparable, and also the metastatic disease, as well as the percentage of chemotherapy and/or radiation therapy in those patients. And if you look to the results, I think it's not easy to look at, but you know I'm a little bit older, so I don't have these nice slides. If you look to the left bar, it's the homeopathic group. Yeah. And there was an improvement of the global health status as well as the subjective well-being in those patients. In addition, also the functional parameters as well as fatigue improved in the homeopathic group, and also pain and dyspnea improved, while only diarrhea deteriorated. In the second part, the control group, there was an improvement in subjective well-being during the course of 18 weeks. That was a deterioration in physical functioning, an improvement in role functioning, a deterioration in nausea, vomiting, and pain, and also with respect to constipation, diarrhea, and appetite loss. Now, if you compare this difference within the 18 weeks between control group and homeopathic group, you look to the right third of this table, which shows that the homeopathic group was significantly better than the control group with respect to subjective well-being and global health status. Also with respect to all the functioning parameters and fatigue, and also with respect to dyspnea and pain, as well as appetite loss. So in conclusion, this was the first prospective control study evaluating additive homeopathy at the same center. You know, Dr. Rostock, he has investigated 2 groups, but those patients were treated in 2 different centers. And global health status and subjective well-being of cancer patients improved significantly with homeopathy. And this study was included into the German S3 guideline, which is used for complementary medicine during treatment of oncological patients. And there it is at least a so-called can indication. So you can do it without being punished. Now, the next study, which is the largest one, and it lasted for about 10 years from the beginning to the end and publication of the study. This was a 3-armed study. It was double-blind, prospective, randomized, and multicenter, and was published in a conventional journal, The Oncologist, in the year 2020. Since limited options for patients with advanced non-small lung cancer, we thought that additive homeopathy might help to alleviate the side effects of conventional therapy, and therefore we investigated not only the quality of life, but also survival in those patients. Now we have 3 groups. The upper group is the homeopathy group, which received conventional treatment and in addition double-blind individualized homeopathic remedies. The second group, with 47 patients, received conventional treatment plus placebo. So altogether there were 98 patients who were randomized and evaluated with regard to quality of life and survival. The third group, the control group, we have included because it could have been, if there's no difference between the first 2 groups, that my suggestion and my placebo Wirkung might have added to this effect. Unfortunately, this effect of placebo doesn't work with my bank account, for example. I don't understand. So this control group were patients only with receiving conventional therapy, and those were evaluated only with respect to survival. And these patients never have seen the homeopath. So the choice of remedies was done in a classical way with help of repertorization. And then when we finally decided to use a special remedy or homeopathic medicinal product, as it is called now in English terms, then we sent either a fax or an email to the pharmacy. Now, the pharmacy used a very special randomizer program, which automatically writes a protocol. So it's not as a usual randomization program, but it automatically writes each patient who is included or excluded of this study. And then the homeopathic remedies were sent by help of mail to the patients, so even the pharmacist could not have any influence on the patient because he didn't or she didn't see him. And every 9 weeks there was a follow-up, and patients were completing questionnaires, which they had to do in the basic before the study, And there was a follow-up history taking, and now we decided to either continue or to change the medication. Now, the characteristics are comparable. They were even a little bit more or worse lymph node status in the homeopathic group, but this was against the homeopathic groups. And if you look to the life quality and the functions scales after 9 and 18 weeks, there was a significant improvement in the homeopathic group versus the placebo group. And also the symptom scales improved significantly after 9 and 18 weeks in the homeopathic group. Now, this would not have been a big problem for all of the conventional doctors. However, the real problem was the homeopathic patients lived longer, and this caused a lot of turmoil, because as you can see on the green bar is the homeopathic group, and those patients lived for 435 days versus the placebo group with 257, and versus the control group living for 228 days after diagnosis. So it's about 6 months difference between homeopathic group and the placebo group, and only 1 month difference between placebo and control group. So my placebo effect is only 1 month. So if you spend time together with me, you will live 1 month longer, but not much more. And, this interesting finding could also be shown in this Kaplan-Meier curve. And we believe that this study is at least a hint that not only quality of life, but also survival improves in patients suffering from non-small lung cancer. In addition, opposite to many other studies which I have read, we had to include the patient within 8 weeks. This was the result of our first mistake. I showed you in the beginning. It would last a little bit too long to talk about this late entry problem. And I think, in addition, we had another evaluation or assessment way, because the planning statistician did not make the final assessment. In between, all the data by a special clearing process had to be brought out of the General Hospital of Vienna, and another statistician, she had to assess this data. So there's no possible influence possible. There's no influence possible by the researchers. So I thank you for your attention. And just 34 years ago, there was a young gentleman, Professor Dr. Pavel Dusinski, who's from the University of Prague. He's just sitting in the first row. And he spent a lot of time together in Vienna. And now he is a famous doctor in your country. And I'm proud to be a friend of him. Thank you so much.